Well, we were going on and on about how good you looked at 2 weeks, and you corrected us. You said it'll be actually 2 weeks tomorrow. So let's be accurate about this. But I think, Charlotte, you kind of exemplify, embody what I keep telling patients is that I have these patients who come to me repeatedly at about their 2 to 3 week point. They say, at 2 weeks, I was having lunch with people who know me well, my girlfriends or family, and they've all looked at me and said, I really don't know what you did, but I really like what you did. And I love to hear that because you don't look done, you don't look plastic. People aren't asking you who your plastic surgeon is because they don't think you've had that done. But it really doesn't happen by accident. It happens because you pay attention to the recovery process, you have realistic expectations, you've communicated your expectations to us very, very clearly, and then you tend to have something like this happen, and it just makes me tickled.
I'm pretty tickled myself, yeah. And it's just that if you listen to what you tell us to do and follow those guidelines, I think you're going to come out ahead of the game every time. Well, I have a story, and I guess it's this. My husband has dementia, and so I've kind of been housebound for a while with his disease. And I was just in a slump, and I thought, I need to do something for me. And like I said, I went into Reveal Beauty because I had seen a few wrinkles creeping up my face, and I thought, okay, let's do this. So I went there, and then I saw that tummy tuck slides coming up in the office, and I thought, well, that'd be nice because I've always had this little pudge in my tummy that bothered me. It made me wear big clothes, and that sort of made me feel older, and I don't feel like I'm an old 73. So I talked to Dr. Clinton about it that day, and then I really wasn't prepared to talk to him about a tummy tuck because that's a pretty major surgery. So I went home, did some research, and I called back a few days later, and I went back in, and we both kind of chuckled like, weren't you here just a few days ago? And I said, yeah, but I got a few more questions. So he was very patient to walk through all my questions and gave me all the answers, and we went with it.
That's right.
And I'm so pleased.
And you know, Charlotte, you obviously don't look 73 to me, but I have people who come in and they're in their 70s, even some ladies in their 80s, believe it or not, that say, am I too old to do some of this stuff? And you know, as long as you are medically stable and in good health, and as long as you've got the right changes, I think the answer is let's sit and talk about it. And you've been a great example of that too, that just because we're in our 70s, it doesn't mean that we can't reap the benefit of what you've been through, and you're a great example of that.
Yeah, and what you said, to reiterate, I love that people will say to me, you look great. What makeup are you using? And it has nothing to do with makeup.
Did you lose weight? Did you color your hair? Yeah, well.
And depending on who it is, sometimes I tell them and sometimes I don't, you know. It's personal, right?
That's right, absolutely.
I just want people to know that if you choose Reveal Beauty to go to for your any kind of skincare needs or surgeries that you may be thinking of, you will come out feeling secure and know that your doctors will be doing you a good service, and you really will not have to worry if you'll just follow the directions that they give you.
Thank you, Charlotte. Thank you.
You're welcome.